before we begin our discussion, I'd like if you could please give me a brief background on yourself.
All right. Well, essentially, I did my undergraduate at the University of Guelph in marine biology, out of all things. Finished there and decided that there was no jobs for marine biology in the Hamilton area. So what I did was ended up going to Georgia College, did 2 years at the opticians program, and then finished that, of course, and then excuse me, worked as an optician for about 10 years, 8 to 10 years. Then decided that I'd go back to school, so I applied for optometry in the UK actually, and did optometry and came back here and worked at the University of Waterloo for about 2-3 years, teaching and back into private practice. So, in a nutshell.
Yeah. Okay. So thanks for that insight. I'll be focusing again on common diseases, cataracts, glaucoma, AMD. Now, just to break the ice here, just an opinion-based question.
Sure.
Out of North America's general population, what percentage of people do you think are aware of these diseases?
I can probably tell you it's probably pretty low. Most eye diseases are pretty much untalked about, unseen, and unheard until it either happens to somebody or happens to someone's family or friend. There's not a lot of awareness out there as far as what the government gives out. Age-related macular degeneration is the leading cause of blindness in Canada, and that's probably one that most people have heard of. So I think that gets out of all the eye disease, I guess that gets the most airtime, I guess, if you think about it. But it's pretty poor. It's probably a few percentile.
Now, according to the World Health Organization, I found this on their website, 47.8% of the world's blindness is caused by cataracts, and at least 50% is in Africa. Now, what is the relationship between Africa, actually Asia as well, and cataracts?
Well, cataract is not a blinding condition, but yet it's the #1 reason in the entire world that people are blind. And it's unfortunate, and all it comes down to is access to health care. So cataracts are an easy fix, but there's got to be someone to fix it. So in sub-Saharan Africa, some of the poor nations, some of the Eastern Asian countries, they don't have access to health care. Remember, a lot of their health care is just life and death. So vision is, way down at the bottom of the list.
Right.
Great to have vision, but these guys are dealing with life and death situations, so they don't have access to health care. It's really what it comes down to, because you need a surgeon to fix a cataract. If there's no surgeon, you're stuck with cataracts. Right.
Now, is there a genetic link to cataracts? Because of the prevalence in Africa and Asia?
No, the common link between cataracts in those parts of the world, the developing nations of the world, usually the closer you get to the equator, the less, I guess, money and healthcare and infrastructure and governments that are able to provide healthcare to get rid of cataracts. So it's really the sun that's the motivating factor here, because the sun speeds up cataract. It's like a catalyst for the cataract.
Right.
So the closer you live to the equator, the least sun protection you get, the quicker you get cataracts in life. And the unfortunate part is those folks all live in the sun, and they've got no access to health.
I actually lived in Africa for 15 years myself, and yeah, I never had sunglasses myself either.
Yeah, that's right. Yeah, that's way besides the point, because there's no protection for UVs.
Yeah.
Sunglasses are the least of people's worries in Africa.
Yeah.
Some food is usually their top priority. Unfortunately. It's an unfortunate fact of the world, and it's an easy fix, but that's why we have Doctors Without Borders and the Orbis airplane that flies around as cataract surgeries.
Now, glaucoma is also a major disease.
It is a major disease, and it's more genetic related, and that's why about 40% of the African American population has some type of glaucoma. Absolutely.
Now, I also found that, as you said before as well, age-related macular degeneration is the leading cause of blindness here in North America.
North American, developed countries, Western world.
Now, why are Caucasians so much more susceptible to AMD than any other ethnic group?
Well, that's a great question, and I don't think we really have an answer for that.
Okay.
But we can kind of speculate. The further north we go, we find that age-related macular degeneration starts to be more prevalent in northern countries, Canada, United States, Europe. The further north you go, you get more Caucasian type of people, right?
Right.
So they get less sun. So they're getting an eye disease and there's no sun involved. So I think we can take sun out of the equation.
Right.
What happens is, what I believe is, it's the diet that really affects North Americans and Europeans. Our diet is pretty poor. It doesn't consist of a lot of fish and omega-3s. It doesn't have a lot of fruits and veggies, which you get in sunny, warm climates.
Right.
And there's a genetic link to it, and I think it's also related to pigment. If you don't have enough pigment in your system, in your body, in your eye, you're more prone to not having those protective factors that pigment can give you. So I think that's my take on macular degeneration. It's linked to cardiovascular disease. We know smoking speeds it up. We know UV energy speeds it up.
Right.
So there's a lot of risk factors that a person that's white can control, and I always give those advice to patients, of course.
Right.
But yeah, and there's a genetic link to it. So it tends to, it's the white people with the glaucoma, and it's the black folks with it's white people with macular degeneration, black folks suffer glaucoma.
Right.
So we have two diseases that affect two huge, gigantic populations of the world.
Right.
One's dietary, and I think the other one's genetics to a certain extent.
Now, if we go that way towards Asia again, we're looking at China, and in 2004, the rate of nearsightedness in high schools was 77.3%.
That's right.
Now, why is it so strong out there?
Yeah, that's the chicken or the egg story. There's a couple camps, and myopia is probably one of the biggest studied aspects of eye care, because it's so prevalent in the world. We know that Asians, Southeast Asians, China, Japan, Asian Oriental countries tend to suffer greatly with myopia. So again, is that all genetic linked? Is it cultural based? Is it tied into their diet? Is it tied into the geography? Is it tied into their scholastic habits? And there are some researchers, from what I believe or from what I know that there is some link to being quite studious. These Oriental people are always known to study and read a lot. The competition in Oriental schools are quite high.
Yeah.
And so they do a lot of near work. So there is a school of camp out there that says, the researchers will say, if you do a lot of near work, your eye tends to stretch, you accommodate, you get this viscid response, so you become a little bit more nearsighted as you read. And anecdotally, I see that all the time with students in their 20s. They start university without glasses, next thing you know, they're -2s. So is it because they do a lot of studying, a lot of reading? I don't know. I think it's genetically related. Myopia started way back when we were fish, because you need to be you need to have a -17 to see underwater.
Right.
So I think there's a genetic link, and why evolution hasn't weeded out that myopic gene yet, I don't know, because it's not good for us to be myopic on land, right?
Right.
Because when you can't see in the distance, something's going to eat you walking through the jungle when we were around 2 to 4 million years ago, right? So myopia has no use for humans that I know of, which is different, a little different than astigmatism. But yeah, Oriental countries for sure.
Okay. Now we've talked about the ethnic groups. We've talked about the particular diseases that affect them. I'd like to go back to my first question of how many people are actually aware. Now you've been here, practicing optometry for quite a while, and you see these diseases at least on a monthly basis, daily basis. Where would most people lie on a scale of 1 to 10 in regards to how aware they are before they come into your office? 1 being less aware and 10 being most aware.
You mean in all patients in general, or just patients that suffer the disease?
Let's say in all patients in general.
Well, that's a good one. I'd like to say that all my patients leave armed with some information.
Right.
I've noticed that in the years I've been practicing, I'm getting more and more into nutrition, eye protection, UV protection. I nag patients if they're smokers. So I tend to do that more often than not. So I would say a large chunk of my patients are educated as an eye care provider, as a healthcare practitioner. It's also my job to inform patients to preserve their sight.
Right.
Because his eye duct is, once they lose their sight, we can't do much to get it back.
Right.
So if we can give them some information, like your dentist does with floss, right?
Right.
So it's my job to tell you to wear sunglasses. It's my job to tell you to eat healthy,
Right.
to take the right antioxidants. It's my job to tell you to stay in the sun, if you are in the sun, or just wear UV protection.
So on that scale of 1 to 10, before they come into your office and before you tell them about it, how many people would be aware?
Probably less than 30%. Yeah.
Okay.
Probably even less than that. That's a pretty gross estimate.
Mm-hmm.
That's being optimistic. Because I will say these to patients and they look at me like I'm talking a different language. Meanwhile, half their family went blind from some disease. I'm like, oh, it can affect me. It's pretty bizarre.
Okay. Now, the 3 O's in our profession, the opticians, optometrists, and the ophthalmologists, do you think we need to create more awareness in terms of ethnic diversity? Because I haven't heard of it myself a lot before.
Awareness, you mean awareness of what the patients see the 3 O's as? Like
what they see the 3 O's as well as what diseases could affect them. Because many people don't know it, right?
Yeah, oh yeah, absolutely. And that's the other thing is that certain populations in the world suffer those certain eye diseases. So these people are higher risk than, this group of people would be higher risk than this group of people. So those people should at least be given the information or made aware, or at least have access just to basic primary health care, whether it come from an optician, optometrist, ophthalmologist, doesn't really matter.
Right.
We're all part of the eye care
Right.
profession. So that information has to come from somewhere. So there, yeah, collaboration amongst all 3 would be the most effective way.
Right.
If all 3 of us can get on board and agree on something, put our money, put our resources together, and advertise what's going on in the world. Our associations do that, but unfortunately, it's not spend a lot of money and effort into advertising diseases.
It's been a pleasure talking about this.
Yeah, no problem.
Thank you.
That's it.
All right.